Live from Radio Row at Super Bowl 60 in San Francisco. This is Roy Kessel for Sports Philanthropy Network, and today we're very excited to have with us special guest Stephen Shaya. Stephen is one of the award winners for tomorrow's Leigh Steinberg party. So, Stephen, welcome to the show.
Thank you for having me.
We're excited to see all the festivities tomorrow. So, share with everybody what you got your award for.
Well, that's a good question. First of all, thank you again. I'm a family practice physician by trade. My family owns a company called J&B Medical, started in 1996. My mother owns 100% of J&B, so we say she's boss at home and at work. But we have a global healthcare enterprise, and we take care of hundreds of millions of people in 49 states and 28 countries. We passionately believe you give people health, you give them hope, and if you give them hope, you give them everything. So we're just stewards of the blessings.
Well, I mean, hope is such an important word when you look at healthcare. Health is not something you can just hope for, right? It's something you have to be proactive with and really, use the best care, medicine, devices, medications, all kinds of things that are out there. So tell us what G&B does to help that market.
So where we've really made our name is making healthcare as affordable and accessible to as many people as we can globally. So we've streamlined the distribution channels. So we provide products and services on a B2B basis to hospitals, pharmacy, physicians' offices. Our claim to fame is we take care of over 260 million patients today via insurance contracts, providing products and services to the homes, diabetic supplies, wound care, ostomy, insulin pumps, continuous glucose monitors. We're one of the largest providers of those products and services in the world. So it's B2B to C, provide products and services to patients, bill the insurance companies. And then on the philanthropic and impact, we do screenings, mental health screenings for children in schools. So for example, in the state of Colorado, we screen all the children, grades 6 through 12. 1 out of 3 children have anxiety. 1 out of 3 children have depression. 1 out of 15 children have a plan to commit suicide within 12 months. And by screening these children, we're able to provide resources and get them plugged into things that can help them deal with that. When people reach their health potential, they can reach their human potential. And so we believe that with social media and a lot of this electronic media now, that's having more of an impact on people's mental health and psyche than many realize. So we're very creative, we're very innovative, and we're finding different ways to, again, make healthcare as affordable and accessible to people.
Well, one of the things that we hear a lot, like when people are looking at the mental health areas, right? People are going on social media and they're comparing, for example, like we are here this week, somebody's highlight film of being at Radio Row to what their reality is.
Totally.
Right, day to day. Like they don't see everything that's going on behind the scenes here. They don't see all the work that went into preparing to be here. What they see are just like you're having fun, you've got some great pictures, and they think that life is just like a gloss of that. But it's very real when people go home and they don't feel they have that highlight that they can use, right? They're comparing their reality to somebody else's highlight film. So how do we help those individuals?
So the number one predictor of mental health status is kind of human connection, bonds. So people that have a strong familial bonds, whether it's guardians, parents, brothers, sisters, grandma, grandpa, the number one predictor for mental health is the quality of those bonds that they have in those lives. So what we're doing is not only screening and identifying, but providing what we call these brief interventions where we train folks how to build those bonds better. So for 3 to 5 minutes a day, we provide different resources so a parent can, or a guardian or a loved one can better communicate, better connect with their loved ones. A lot of times it's not boiling the ocean, it's consistently, doing things and communications and, the power of human connection. We underestimate it, but especially now with social media, people have a different view of it.
Well, doing that screening is hard, right? People want an easy answer. They want some method where I can just wave this over your head and I'm going to get a red light or a green light, and that's going to tell me, oh, something's wrong with Stephen or Stephen's fine. And life isn't that simple. So take us through the process of what does this screening look like?
So it had an evolution. So at first we did in Colorado. So I'll use Colorado as an example because we screen all the children in Colorado grades 6 through 12. But at first, anyone that went to one of the clinics in the schools would automatically get a health screening. And again, we started to identify things that were not diagnosed and started to plug them into the resources. And there was a 61% improvement over 12 months with these kids and their mental health status. So state of Colorado said, well, we need to expand this. So now we are doing all the children. So some of them get a once a year, screening. Some of them get a once a month screening. If we flag someone with something, then we start tracking and doing the screenings more often. But just like with everything, it's not a one-time, to your point, it's not an instant thing. We like to say relentless positive action. First you got to identify them, and then, constantly, just like with anything, there's no easy answers.
No, and that's one of the challenges, right, as you do this. So you're doing it in Colorado now. What's your expectation for being able to expand that to other locations?
Well, we're doing different iterations of this in 32 states. So we just started a big one in Maryland. We're doing one in Louisiana. And the starting point is the children. And we're starting 6 through 12. It's hard to get them much younger than that and we're also trying to do screenings now with families. We have a lot of companies we're working with to do screenings. We have some special programs where we take monies from the health savings account, flexible spending accounts to do these screenings. So we've kind of come up with a very easy modus operandi to do it. But there's undeniable proof that shows that mental health status, there's huge cost savings because it's like almost $15,000 difference a year for people who have mental health status and chronic diseases like diabetes, CHF. So, just like with anything, it's like an onion. You peel a layer, there's another layer, another layer. It's very personal for me. My wife's first cousin committed suicide 3 years ago, 37, 3 young kids. And throughout his entire journey, he never had the support. There was times where people flagged him, but then he just, there was no follow-up. So our whole system, it's an epidemic, mental health. And I think with social media, I think with COVID, we're going to see some consequences of COVID show up down the road. It's not something that gets talked about, stigmatized. It's very hard for people to talk about, when their loved one has some sort of mental health issues, but I think as a society, we have to be able to have these honest discussions. And that's the best way to help improve people's, like I said, you improve their health potential, you improve their human potential.
Stephen, thank you for joining us here on Radio Row at Super Bowl 60. Congratulations for your Humanitarian Award. We're proud of the work you're doing and look forward to seeing how we can collaborate to bolster your efforts.
It would be an honor. Thank you so much for having me.
And for all of our viewers and listeners, thank you for joining us live on Radio Row at Super Bowl 60 in San Francisco. This is Roy Kessel signing off for Sports Philanthropy Network. Please remember to live generously.